Welcome to Appalachian Wellness for a new tomorrow and a new you. This is a detailed overview introduction of Chronic Inflammatory Response Syndrome, or CIRS. I'm Raymond Owen Brink, the principal and physician at Appalachian Wellness. So, welcome. Let's take a review of what this disease is all about. The immune system function and organization. CIRS, Chronic Inflammatory Response Syndrome, is best defined as a complex chronic illness. It's also known as a multi-symptom illness. Symptoms will depend on what systems are involved. You can think of having a broken off switch on the immune system. Macrophages typically present portions of the antigen or the germ to T regulatory lymphocytes, and in this case is a faulty presentation, which is what causes the broken off switch. Essentially, this broken off switch leads to autoimmunity, in which the immune system starts to attack self. We think that about 25% of the general population is genetically susceptible to this illness. Genes load the gun, exposure pulls the trigger is the phrase describing the illness coined by Dr. Shoemaker, who came up with the whole concept of CIRS. Treated. Nobody in their right mind would contact the Air Force to get the use of a submarine, right? Our immune systems are set up very similar to the U.S. Department of Defense, which has the Army, Air Force, Marine Corps, Navy, Space Force, and Guard. The immune system has antibodies produced by B lymphocytes, which are derived from bone marrow. Antibodies, of course, have various classes and responsibilities as well. IgG, immunoglobulin G, think of that as the Army providing long-term surveillance and protection. IgM, the Marine Corps. First on the beach, they rise during acute illness, then they fall off as the IgG builds up. IgA is found on mucosal, moist surfaces such as the GI, GU, and respiratory tract. IgE, allergic reactions and parasitic illnesses are their specialty, and then IgD is found in the fetus. Lymphocytes come in other forms as well. They have their own functions based on where they're from. T lymphocytes are derived from the thymus gland, which is present in fetal and early childhood life, but then devolves later in life and virtually disappears. There will be a little fatty streak left of it deep to the sternum. If somebody has chest surgery, they may find that there. T helper CD4 lymphocytes activate the immune system and promote inflammation. CD8 regulatory lymphocytes help curtail excessive inflammation, which can be harmful. NK natural killer cells help eliminate threats by killing cells, such as perhaps cancer cells or cells that are producing too many viral particles after a viral infection. There are other T cell populations which have their own distinct duties, including modulating various aspects of the immune response. There is a continuum or spectrum of illness leading from normal to CIRS, to something called Mast Cell Activation Syndrome, multiple chemical sensitivity, and EMF sensitivity. You can swing back and forth or up and down between these different layers of the chronic inflammatory spectrum, depending on the total toxic burden. So if you're one of the unlucky 25% that should have picked better parents and you've got these genes, let's at least let you know what you get yourself into, shall we? So genes load the gun and exposure pulls the trigger. What is an exposure? Toxic mold, we've all heard of that. They produce mycotoxins, literally mold toxins. These are volatile organic compounds, airborne organic carbon-based chemicals. So human beings are not exactly the target for these things, and we do not have an infection going on. Typically, the building that you're in may have an infestation of such mold going on, and these molds are producing these compounds to help protect their resources, such as food and moisture, that sort of thing. Humans are just collateral damage. We're not the intended targets for these mycotoxins, or VOCs. Lyme disease is another very big one that starts the inflammatory cascade that leads to CIRS. Anything that causes a pro-inflammatory cytokine storm. Cytokines are chemical messengers that go from one cell to another and sort of help keep everything working properly. Other exposures: shellfish beds that dry periodically, river beds that dry periodically, blue-green algae, cyanophyta, red tide blooms, sepsis, critical illness, being on a heart-lung bypass machine, numerous other things can trigger this pro-inflammatory cytokine storm. Exposures in susceptible folks leads to CIRS. Ongoing exposure can lead to further progression to something known as Mast Cell Activation Syndrome. We used to think of mast cells as being like hand grenades all over the body. If they all went off at once, it led to fatal anaphylaxis and you died. Charlie Darwin didn't like that idea. He told us to go back to the drawing board, so we did. Now we think of mast cells more like neighborhood cops that keep everything running and organized in a smooth manner in tissues and organs between cells. Sometimes, however, they go rogue and cause problems. A rogue cop beating on the good citizens with a shillelagh is no good, and mast cells that are too active are also no good. The continuum spectrum of this illness includes mediators secreted by the mast cells, such as histamine, bradykinin, leukotrienes, among others. When the mast cells are overactive, releasing too many inflammatory mediators, the next step of the spectrum will evolve. Multiple chemical sensitivity can have triggers such as bleaching agents, detergents, artificial scents, colognes, perfumes, and scents in other products. Febreze and dryer sheets are a couple of really big no-nos to avoid. EMF sensitivity is the next thing that happens. When you've got EMFs, they can cause the molds to release more toxins. Higher frequencies, shorter wavelengths have more energy and they're more problematic. Lower frequencies, longer wavelengths are safer. Frequencies is described as hertz, or cycles per second. 1 kilohertz is 1,000 cycles per second. A megahertz, 1,000,000 cycles per second. A gigahertz would be 1,000,000,000 cycles per second. Anything in the range from about 300 megahertz to 3 gigahertz is harmful for human health. And as I mentioned, it also makes mold release more of their toxins as well. This is a look at the electromagnetic spectrum. The visible wavelength is really kind of small, and you can sort of see this area right in here where we'll have the visible wavelength going on. The total toxic burden. Think of the straw that broke the camel's back. It wasn't the straw that broke that poor camel. It was those other load of hay that went on ahead of the single straw. Think of exposures as reviewed above. Each one is a separate bale of hay on that poor camel's back. During World War II, the U.S. fought Europe and Asia. However, once VE Day happened, we concentrated all of our efforts in the Pacific and made much faster progress there. Sometimes what we'll see is as you've got, say, mold-related illness and Lyme disease, as we start getting rid of the mold toxins, the Lyme disease scores will worsen. And what's actually happening is known as a Herx reaction effect. You're actually improving, you're killing more Lyme disease, but you're not getting better, or you're getting better, but you're feeling worse. So the Jarisch-Herxheimer reaction was first described by Drs. Jarisch and Herxheimer in dealing with syphilitics who were being given antibiotics. As the organisms were dying, these spirochetes, they were releasing things that caused inflammation from the immune system. Syphilis is part of the family of Spirochetaceae, so is Lyme disease, Borrelia. So what Jarisch and Herxheimer documented was that when these folks were worsened given antibiotics, the organisms were dying. They were releasing inflammagens, molecules that stimulated the immune system reaction, causing fever, chills, joint pains, muscle pains, aches. Numerous other systems were being affected. So clinically, what does a Herx look like? Pretty much anything you don't like. I kind of semi-seriously tell my patients that if their candidate lost the election, it could be a Herx reaction. A speeding ticket can actually be a Herx reaction, seriously. Chronic complex illness causes brain inflammation. Toxic encephalopathy literally means inflamed brain disease or poisoned brain disease. Brains can react by having emotional issues. So you leave the doctor's office, you're stuck behind a slowpoke, you're impatient, you pass in a no passing zone. That speeding ticket you just got is actually a Herx reaction. I don't think you can use that excuse to get out of it, though. The complement fixation cascade. Imagine a room full of terrorists. A bad thing. Now imagine you have a bucket of hand grenades. A good thing. So you sneak up onto the room of terrorists, pour the bucket of grenades in the room, After there's a whole lot of industrial strength snap, crackle, and pop and the smoke clears, you see a room full of pieces and parts of former terrorists. A good thing. Of course, that room is not exactly for formal function that night either, because it's been trashed as well. So compliment is not my opinion or a statement about how nice you look today. Nope, sorry. It has to do with another immune system division that consists of proteins that are normally present in the bloodstream, and when they trigger each other and go off, they can kill a lot of different things, such as bacteria and that sort of thing, but it's a double-edged sword. When the complement fixation is activated, it's like bombs going off all over the body, killing germs, also harming the tissues and the organs in the body. So biological chemical systems are activated by enzymes. Think reagents A plus B in an enzymatic reaction producing C as a product. It may produce not just one C, but maybe 1,000. Then C and D gets together and produces E. Again, maybe 1,000. So you started out with one A, now you can end up with millions of E. This is what we call a feed-forward amplification loop, a logarithmic increase in. This is what happens when the complement fixation cascade goes off in any organ system. It damages the organ itself, causing inflammation as well. Inflamed organs don't work the way they should. So this bucket of hand grenades saved your life, but it caused some problems as well. So remember, unrestrained, excessive, and/or chronic inflammation is bad. Just a little dab will do you. Acute temporary inflammation is a good thing. Chronic inflammation, not so much. Let's talk about the mitochondria. They're the power plants in your cells that produce ATP, the energy currency of the cell. They do this by oxidizing or burning carbon and hydrogen found in fats and sugars to carbon dioxide and water. It's not like a little furnace with a pilot light, though. These are cyclic enzyme system-driven reactions. The first we'll call is glycolysis. Glycolysis does not require oxygen, produces about 30% of the possible adenosine triphosphate, the energy currency of the cell that powers all the cellular activity and work. It also produces lactic acid, lactate, and pyruvic acid, pyruvate, among other things, such as ethanol. Cells and tissues don't do very well swimming in acid, so luckily, we have the Krebs cycle that takes the lactate and pyruvate and converts that over to oxygen, using oxygen to CO2, water, and produces 70% of the ATP that the body needs. Folks with CIRS fail to use the oxygen present in their bloodstream. The oxygen is present, it's just not being used properly. The visual contrast sensitivity test looks at how well the mitochondria are working by evaluating the black and white receptors, the rod cells in the retina, the film in the back of the eyeball. Failure of this mitochondrial function is failure all over the body. So these poor people are not just tired, they're exhausted and unable to function. They get into oxygen debt. Now, the body can resynthesize glucose from the lactate and pyruvate, but it takes time and oxygen to do that, and we've got this impaired oxygenation system. So it takes time. It takes a lot longer than with normal people. We've been able to use this information to put together a stress test that satisfies the folks at Social Security disability income. The folks at SSDI will give disability to people who are not able to maintain a certain metabolic equivalence. The energy expenditure while you're at rest in a comfortable room, not sweating, not shivering, is about 3.5 cc's of oxygen per minute per kilogram of body weight. We have a stress test that I've devised that can determine if SSDI disability requirements are met. And if you're interested in that, please talk to us during your visit. We'll schedule something like that for you. So far, at the time that this slide is being created, we have a 100% batting average. If we say that people are disabled, they do get SSDI. And we also have an attorney that we can refer you to that's got a pretty good track record as well, getting folks with disability the assistance that they need. So if you think you're disabled, we may be able to help. This knows we know what to look out for. The CIRS treatment protocol, Dr. Shoemaker, as I mentioned earlier, is the physician who initially came up with the CIRS concept. And he came up with a stepwise protocol for treatment on how to take care of all the various multi-system, multi-symptom problems that are going on. He did this by breaking down this complex disease into a bunch of different moving parts to make each one understandable, and then as we correct each one, we could actually get from this illness. So there's a stepwise treatment protocol that Dr. Shoemaker recommended. The first step is at the base of the pyramid, removing ongoing toxic mold exposure. Next, we treat with binders, agents that will pull the toxins out of the body. We also try to get rid of multiple antibiotic-resistant coagulase-negative Staphylococcus aureus, which is a type of staph germ that colonizes the nasosinus area. There are numerous other issues that happen as well, gliadin sensitivity, celiac disease, wheat sensitivity. With CIRS, you can get a reversible temporary gluten sensitivity. We have to correct ADH and osmolality, how well the kidneys are working, and matrix metalloproteinase 9, vascular endothelial growth factor, complement 4A and 3A, and transforming growth factor beta 1, among others. Step 1, the most important step, is removing all ongoing toxin exposure. We can get you better but not well if this is not done. Step 2 involves binders such as cholestyramine or Welchol. Cholestyramine is about the strongest binding agent out there. The liver is arguably the largest organ in the immune system, and what it does is it filters toxins out of the blood, stores them into bile in the gallbladder. You see it there in the green. When you have a fatty meal and you eat, the fat gets into your system, it causes the gallbladder to contract and squirt bile into the small intestine to help with absorption of fats. This bile contains toxins, however, and these toxins can be bound with drugs such as cholestyramine and exit the body in the stool. So when you have a fatty meal, bile gets squirted into the duodenum, the first part of the small intestine, later to be reabsorbed in the ileum. The toxins will go along with it unless you take the binding agent such as cholestyramine. If you don't have the gallbladder, the bile is constantly dripping into the duodenum, and you don't necessarily take cholestyramine before meals. It does work better though if you've got a gallbladder and take the cholestyramine before meals or whatever binder you're using. Welchol is another binder that's about 20% as effective as cholestyramine. These drugs have a molecular pattern that kind of grabs these toxins, sort of like a ball and glove, and pulls the toxins out in the stool. There's a variety of non-prescription supplements that can also work pretty well as binders. Michael Gray wrote a protocol that involves non-prescription binders. That's in the library section of our website. The adverse reactions can also happen with the binders as the toxins are removed. They'll be released from other parts of the body, and as they're in the circulation, they can cause symptoms as well and make you feel kind of sick, such as the Herx-like symptoms that we talked about earlier. Sometimes we need to go to a less strong, less efficacious, potent binder because the patient can't tolerate the real strong ones due to unloading too many toxins at once. Cholestyramine is the strongest binder. It's about 5 times stronger than the next one listed. It's a finely ground yellow-orange powder. Kind of tastes like Tang, the astronauts drink. It's got a bit of a gritty texture, however. The longer it sits in liquid, the more palatable and the less gritty it will be. Keep it in the refrigerator. When you're ready to take a dose, mix your next dose and have it sitting in the water so you're ready for it a few hours later when you go to take your next dose. And it works best if you take it before meals. Provided you have a gallbladder. If you do not have a gallbladder, you can take it anytime you want. Constipation is the biggest problem with cholestyramine. Magnesium salts, except for magnesium glycinate, will help loosen the bowels. Magnesium glycinate does not have that benefit. We're all deficient in magnesium in our diet anyway, so take as much as you need to keep your bowels moving. High doses of vitamin C can also have a bowel moving effect as well. Start with 3,000 milligrams 3 to 4 times a day if tolerated, and that should also help to get you moving your bowels. You don't want to get bound up while you're taking these medications. MRSA, MARCoNS, multiple antibiotic-resistant coagulase-negative Staphylococcus aureus, is a type of staph organism, as we mentioned. It forms a thick nasosinus biofilm called snot, and that's what keeps it from getting neutralized by our antibodies and by any antibiotics that we may swallow or take. It's metabolically active. It lowers melanocyte-stimulating hormone levels, which causes a bunch of other problems that we need to deal with. There's a lot of lab work involved in nailing down the diagnosis and establishing what's going on and what needs to be done with our CIRS patients. We look at the anti-gliadin, the antibodies, ADH, osmolality, matrix metalloproteinase 9, which is a marker for inflammation, vascular endothelial growth factor, another inflammation marker. C3A has to do with Lyme risk. C4A has to do with mold, transforming growth factor. These are all parts of the Shoemaker pyramid. Peptide therapy is at the top of the pyramid. Not everybody needs it. Shoemaker describes it as it sweeps up the dust and ashes and puts on a fresh coat of paint. It can really be a remarkable benefit, but it does not work if you're not ready for it. There are certain prerequisites that need to be met. Another type of peptide is BPC 157 that costs about half as much. Thymosin beta-4 is another one. These are given as nasal sprays, the peptides are. They can restore brain volumes, they can resolve pulmonary hypertension and high blood pressure in the lungs, which has about a 5-year life expectancy. So peptide therapy can be a really big deal. But if you've got ongoing exposure to toxins, if you have a failure on your VCS test, if you've got MARCONs going on and other conditions, then the peptides will not work for you. You have to clear up those other issues first. This is a rather busy looking slide, the biotoxin pathway. It's really nothing to worry about though. If you take a look here, it's only the underside, the bottom half of this that's really important. Reduced MSH, melanocyte stimulating hormone. With melanocyte stimulating hormone, it normally produces pigment in your skin cells, but when it's low, it will cause sleep disturbances. You'll wake up tired, chronic pain, GI problems. Think of irritable bowel syndrome, pain, bloating, altered stooling. Prolonged illness, you don't bounce back very quickly. Changes in production of cortisol from the adrenal glands. The pituitary is the master gland in the body. It produces ACTH among other hormones. ACTH, adrenocorticotropic hormone, causes cortisol release, which happens with inflammation and stress from the adrenals. Initially, you put out excessive amounts of cortisol. As the adrenals burn out, you're not able to make up with the demand needed, and you'll find yourself producing less cortisol. Reduced androgens, testosterone is necessary for men and women. Reduced ADH means you're producing large volumes of dilute urine, so you're running around thirsty, drinking all the time, water that is. And again, MARCONs in the yellow box up there. When MARCONs is present, it lowers MSH. When MSH is low, it produces more MARCONs growth. So this is yet another example of a feed-forward amplification loop. Think of a snowball rolling down a hill. MSH is the pivotal player. Again, it usually puts pigment in skin cells. But when it's low, sleep disruption, pain amplification, GI disorders, IBS, prolonged illness, pituitary and adrenal malfunction, androgen testosterone deficiency, ADH deficiency, increased risk of MARCONs. Sleep disruption, you wake up tired, you get poor sleep efficiency, difficulty falling asleep, frequent awakenings at night, sleep cycle disruptions. Pain is worse, this chronic pain. You hurt more, you're miserable. I've cared for many ladies who've had natural childbirth, but boy, when their MSH is low, a paper cut feels like a lethal wound. Chronic pain, fibromyalgia, is also very much affected. GI disorders, as mentioned, prolonged illnesses, you don't bounce back. Disruption of the hypothalamic pituitary adrenal axis, HPA. That has to do with how the adrenals are working and the amount of cortisol that's being produced. Again, initially you have high cortisol levels, and then the adrenals can't keep up with the demand, and the levels drop a little bit. And it can just make you crazy when you got too much adrenal action on as well. Initially, the adrenal glands can't keep up with the demand, and eventually they just kind of burn out. And we try to do blood work to find out how the adrenals are doing, and we treat you accordingly. Initially, we'll use botanical and herbal products. If necessary, we can use pharmaceutical assistance such as hydrocortisone. Androgen testosterone deficiency is needed by both men and women. Again, ADH. We can do a lot of different things to help with this. We can give people desmopressin, which is what we give kids that wet the bed that make too much urine. That works for us as well, adults. Oxytocin is another drug used for this. Marcons, again, we like to get that under control and treat it as well as we can. Take a quick look at this slide. This is a piece of sheetrock. You can see the drywall where it's torn. It doesn't look all that bad, but that black stuff inside is called Stachybotrys, which is the worst of the worst of the molds. The toxins it produces, trichothecenes, were actually weaponized by the United States Department of Defense. I mean, this is some really seriously deadly stuff. If you wet it, it will grow. Wet it could be as much as just 50% relative humidity. You don't necessarily have to put a garden hose on it. These spores are everywhere. If you wet them, they will grow. They may be black. They're not all toxic black. You can't tell toxic from non-toxic without a good lab analysis, excuse me. So imagine, if you will, a laboratory that can take ordinary house dust, isolate DNA from the house dust, and tell you what species have been present in your house. This is the gold standard. It comes in two flavors. Hurts-Me 2 looks at 5 species of mold. Then the Environmental Relative Moldiness Index looks at 26 species. The data is presented quantitatively, so you can tell how many of these organisms are present in your building, get you a better idea of how safe it is. This is a standard bell curve, and you'll notice that at the bottom row there, 16%, 15.9 to 84.1% is the green zone. There are 3 standard deviations to the left and 3 standard deviations to the right of the mean, the average, the 50% mark. So if we were looking at how tall people are across the United States, in red we'd have Dorothy's friends, the Munchkins from The Wizard of Oz, and in the blue we'd have the NBA. So you want to be as close to the green zone as possible. And the reason I present this is we can actually do a special volumetric MRI scan that can measure down to 0.01 millimeters. Cortec Labs is the company that made this software. Not every MRI scanner is able to do it, but what they can do is then compare your measurements based as a percentage of intracranial volume with their database of thousands of age and gender-based normals to have an idea of how you're doing. So, very good test to get an idea of what your brain inflammation levels look like. So areas that are larger than 50%, think of inflamed, itchy, and twitchy. I've got one raw nerve and you're dancing on it. Small areas less than 50%, plumb tuckered out, cannot do the job anymore. CIRS damages the blood-brain barrier, so what should be like a steel vault becomes more like a leaky sieve, causing the toxic encephalopathy or poisoned brain disease. An inflamed, poisoned organ won't work normally. Don't expect it to. So the brain is certainly one of these organs. And when that brain is inflamed and when that blood-brain barrier has broken down, you can expect cognition, thinking problems, memory loss, and also a lot of various forms of mental illness, depression, anxiety, bipolar. A whole range of different disorders can be present, including schizophrenia. Anyway, this is just a quick overview, somewhat detail-driven, of what CIRS is all about. I also have a CIRS overview video that looks just basically at what you need to do with it. Some people get overwhelmed by the detail presented in this particular video, so I do have an additional one listed as well. I hope you find this helpful. If you have further questions, I'd encourage you to look at our website. There's a lot of information there. And if you're already a patient in our practice, you'll have access to what I call our table of contents document, where there's even more information that I have curated and think is worth your review so that you can learn more about this disease, because with complex chronic illness, knowledge truly is power. Thank you very much for your time and attention. My best wishes to you.